So my name is Dr. David Andorsky. I'm a hematologist at the Rocky Mountain Cancer Center in Boulder, Colorado, and part of the Sarah Cannon Research Institute research program. I'm a co-author this year at ASH on a presentation of a study called Cardinal, which is looking at a new treatment for chronic myeloid leukemia called TERN-701. So the field of chronic myeloid leukemia, CML, has evolved a lot over the past 20 years. It used to be that it was a disease that you needed to get a bone marrow transplant for in order to survive. But now we are blessed with many different oral medications that can effectively put the disease into remission, and patients can live out their normal lives as long as they take their medication. So despite having all these new medications available, we're always looking to advance the field and find things that are better than what we had before, particularly for patients that may have trouble tolerating the other medications due to side effects, or patients whose disease is resistant to it and may need other treatment options. So TERN-701 is one of the newer molecules in this area. It works a little bit differently than most of the other inhibitors, tyrosine kinase inhibitors for CML. Instead of binding to what's called the ATP binding site on the protein, it binds to a different location, and we think that may help improve its effectiveness and also give it a better safety profile in terms of side effects. So this molecule, this medication, TERN-701, we looked at 55 patients so far in this phase 1/2 study. So the first portion of the study involved the dose escalation, starting at the starting dose of 160 milligrams, and then we progressively increased the dose up to 500 milligrams. And now we've entered the second phase of the study, which has a 320 milligram dose and a 500 milligram dose. We're being compared to see if the higher dose is better in some way, or maybe the lower dose is better. So the data from this presentation are mostly from the patients treated in that dose escalation portion of the study. What we found was that the drug was very well tolerated. So of 55 patients that were enrolled and treated, only one of them discontinued due to a side effect. Most of the side effects were very low grade, things like diarrhea or nausea or headache. The hematological side effects, low blood counts, were very rarely seen. So very safe and effective drug. Again, it's an early data cut looking at only 55 patients, but it's very promising. In terms of effectiveness, what we look for in most of the CML studies is what's called a major molecular response, or an MMR, which means that your PCR level measuring the protein of the leukemia is less than 0.1% on a certain international scale. But that's really the benchmark that most studies are using to say, have we gotten patients to good disease control where we're happy with the control of the leukemia. So in this study, I believe the total was about 75% of patients were in MMR at the 24-week cut point, which was the primary kind of efficacy endpoint for the study. Most of those patients had not been at MMR at study entry. Some of them had, but again, the total MMR rate at 24 weeks was 75%, which compares very favorably with other medications in this space. So in conclusion, these are early data from very promising new treatment for CML. We're looking to add about 80 more patients to the study at these two dose levels that were selected based on the phase 1 data. And we hope to have more data to present at ASH in the next year or two, showing a larger patient panel and more experience with the recommended phase 2 dosing. So thank you for your time.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.